Hi folks, Dr. Arianna Anderson here. The following video is one of our health lectures on food allergy and intolerance. This topic is actually very near and dear to my heart since it has so greatly impacted my own family's health. Finding an efficient way to uncover food sensitivities has dramatically increased not only the health and wellness of our own family, but also those individuals that come here to our practice. This lecture will walk you through a little brief history of food allergies. We're going to talk a little bit about how food allergies work, what differences there are between a food allergy, a sensitivity, and an intolerance, and then maybe some of the possible causes of food sensitivities. I hope this information helps you on your journey to better health. So this is near and dear to my heart because our family, actually we found out that we had a myriad of food intolerances maybe about 4 or 5 years ago, and one of our sons actually does have celiac. So it was kind of a long, painful process of having to figure this all out, but then, once you figure it out, boy, it makes life so much better. So on we go. So everybody's heard of the Hippocratic Oath, right? So Hippocrates lived a long time ago. He was the father of modern day medicine, and he did quote to say, "Let food be your medicine and medicine be your food." So food has always, always, always been an intricate part of healing and regeneration in the body. Always has been. In our country, though, just over the years, it's kind of fallen out of our typical idea of what medicine is. But ultimately, food is what brings nourishment into the body. It's actually your replacement parts. That's the only way that you get replacement parts for your body to actually heal and regenerate. So your food is important. So, I'm sorry if you can't see that. I'm going to go through it. Some of these slides have a lot of information. I'm going to break it down and make it really easy for you. Because if you've ever dove into the study of allergies and intolerances, it's vast and wide, and sometimes it really can become a little bit overwhelming. But just to give you a little history on allergies and where they actually first started popping up and started to be recorded in medical journals and that, there was Baron Clemens. He was a pediatrician. He found that young patients and this was back in 1906, had with reaction symptoms when certain foods were eaten or pollen or they were introduced to pollen or an insect bite. And he called that altered reactivity, and then ultimately started to be called an allergy. So this was over 100 years ago. And in 1925, they actually did formulate a definition of an allergy as a reaction where the immune system was demonstrably involved, meaning mainly through skin prick tests, which I'm sure you've all heard of, and probably some of you may have even had. But that it did not include any delayed or masked food allergies in the definition, which are they're slower responses and they have fewer symptoms. Although they knew that it occurred, it was not included into that original definition. And this is where things get murky, because there is something called an allergy, a food allergy, and there is something called a food intolerance. And then we'll get into it a little bit later. The food sensitivities is like the umbrella of both, but there's the two different kinds. So in the 1960s, they figured out what's called IgE, an IgE reaction. It's an immunoglobulin E, which is the main villain in classical allergic conditions. So when you think of like anaphylactic shock, or where people have to have EpiPens, things like that, or like when you're around dust or pollen and you start to, drain, mucus and things like that, that's a classic allergy. They did develop the RAST test, and I'm going to try to pronounce it, radio allergosorbent test to confirm excess IgE antibodies in the body. So they did find that in 1960s that they could actually confirm whether someone did have that type of an allergy. Now, the main reasons why delayed or masked food allergies were not included in this definition was mainly because the medical establishment and then large food manufacturers. So the delayed type of food intolerances, couldn't put a really good standard of care around them because they were wide and varied. And since they were delayed, it was really hard to pinpoint what was causing them. Whereas like a classic allergic reaction is immediate almost always, and it's very easy to be able to recognize and have a standard of care around. So that was the main reason why that wasn't included then. And then large food industries, they didn't want whole food sections that were their revenue for people not to want to eat them, right? And unfortunately, wheat and milk were the most common, and even back then they knew that. And largely it has to do with the fact that they're both a little bit hard to digest. And so if someone has some weakness in their GI system, anything that's hard to digest is going to give them some problems. And we'll talk a little bit more about that. All right, so I'm going to give you two stories before we move into some of the nuts and bolts of this. This is going to kind of just give you an illustration of how an allergy and an intolerance can look completely different. So we have Jane, and these are actual stories. So Jane, when she was a baby, she had colic, vomited, spit it up. She spit up very often, had eczema. She was a baby. Toddler through adulthood, she had mild hay fever and asthma, and her mouth and tongue would swell after eating some types of foods, and she would have to go to the hospital. She did use a skin prick at some point and found out she was allergic to cats, grass, and peanuts. And the skin prick test is very, very effective at figuring those things out, because they scratch you, they put some of the antigens in there, and then you see how much of a response you get. So, I mean, if you have a real allergy, it'll get very swollen and like welted almost. Now Susan, on the other hand, her, as a toddler through adulthood, she would get frequent colds and chest infections, but that was the only symptom that she really had. But she would have those often. In adulthood, she got diarrhea once while traveling, and she never fully healed, and eventually got diagnosed with IBS, which is irritable bowel syndrome. She did get a lot of headaches. She was sensitive to light, sensitive to chocolate and alcohol, and she had a lot of knee pain. And then eventually she was diagnosed with having food intolerance to milk, wheat, rye, barley, yeast, oranges, lemons, beef, and tomatoes. There's a lot of it. That stinks, but yeah, right. But the thing is that these are both having problems with foods, but completely different symptoms, which you can see why it becomes a little bit of a tangled web when you get into dealing with food intolerance. So, how allergies work. These words you've probably already heard. And sometimes they get kind of mixed up back between the two, but antibodies are protein molecules created in the body to help combat disease, such as pathogenic microbes. All right, so that's what an antibody is. And an antigen is actually, antibodies will bind to these, and usually they're bacteria or viruses, but they bind to them and create this big target, like come get me and get rid of these, right? So that's what an antigen is. Now, the problem is, antibodies are made in the body to also clean up food proteins, and they also clean up other body tissues such as thyroid or pancreas. Like for instance, if you had like an infection or maybe an injury to your thyroid, some tissue might get into the blood. Well, your body needs to clean that up. It doesn't want thyroid tissue just running through its blood, so it creates certain antibodies that'll go out and get it and get rid of it. So it's normal to have some of those antibodies, but the problem is sometimes those become over-exaggerated and you start to have too many of them, and then that can that's where you start to get into what's called autoimmune disorder. And then you have your own body's antibodies are actually attacking like thyroid tissue or pancreas tissue. That's one of the reasons with type 1 diabetes. So we have beta cells in there and your body actually attacks them and then it can't create insulin. So, looking at this probably would start to make your eyes roll back. Don't do that. I'm going to explain it and make it super simple for you guys. But the thing is they're really actually important. This is the actual reason why we have different reactions to allergies and intolerances. Remember I told you that immunoglobulin E? Remember that one? That's a classic food allergy. Those particular immunoglobulins tend to be in mucus tissue, like throats, lungs, mouth, ears, where you might have any type of a mucosal lining. That's where they tend to be, and so that's where you tend to have the reaction. That's where like anaphylactic shock, so all of those breathing passages, all the stuff becomes swelled, because that's where those particular immunoglobulins are at. Immediate symptoms. Most common symptoms are hives, difficulty breathing, vomiting, hay fever, asthma, non-seasonal runny nose, eczema, and anaphylactic shock, obviously. That's your classic food allergy. Now, we're getting into two different ones, immunoglobulin A and immunoglobulin G. The immunoglobulin A, those are for more severe intolerance reactions such as celiac, like what our oldest son at home has. They're more severe symptoms, but they oftentimes are delayed, and they work primarily in the intestines. So this is another reason why a lot of times it's delayed. Sometimes it depends on how fast the transit is through your intestinal tract. I mean, you should be having a bowel movement every day, but some people don't. Some people have several day bowel movements, and it also depends on how well they chew and eat up their food. If the food particles are stuck in the beginning part and it starts to weave its way, it depends on where it is when it actually, the antibody reaction is actually triggered. So it causes irritation and inflammation of the intestinal tract every time a particular food is consumed. Common diseases and symptoms are diarrhea, loose stool, constipation, gas, acid reflux, vitamin and mineral malabsorption. So if you see somebody that you know actually eats, but they just look sick, like their body just isn't absorbing the nutrients that they're bringing in. That happens a lot with Crohn's disease. Intestinal hyperpermeability, or sometimes it's called leaky gut. That's its common sort of name on the web. That's actually where, and we'll talk about it a little bit in more detail, but where proteins that aren't supposed to be able to get into the blood are able to get in, and then your body starts to build antibodies towards them. Severe abdominal pain, nausea, skin rashes, respiratory issues, and irritability. So those tend to be the more severe intolerance. But then we also have what's called IgG food reactions. And this, unfortunately, there usually is an autoimmune component. This is where, when these are present, that usually means that there's something, the body is actually becoming overactive and it's starting to actually destroy its own tissue. Unfortunately, with these, they are delayed, usually hours to even days. When food particles find their way through a hyperpermeable gut, remember, bigger proteins can get into your blood that shouldn't be there. The body creates these antibodies to clean them up. But unfortunately, sometimes that can trigger more of those antibodies than is supposed to be, like for instance the thyroid. It's called Thyroid Peroxidase. Certain foods, and they don't know why, but certain foods, usually wheat or dairy, if somebody does have these particular antibodies, when they eat them, it triggers this hyperimmune response, and then they have an upregulation of those antibodies. So usually you have 35 or less, like on a blood work panel. They'll get anywhere from like 150 up to 1,000 of those antibodies, and what ends up happening is they start to destroy the tissue itself, which is not good. So common diseases and symptoms are inflammation, constipation, Crohn's disease, which I mentioned, diarrhea, eczema, flatulence, irritable bowel syndrome, and migraines, obesity, and psoriasis. Psoriasis oftentimes accompanies that, unfortunately, which is a skin disorder. So just remember, there's allergy and there's intolerance. So the allergy, a skin prick test will work just fine to figure out what's going on. And that is your it's an immune reaction that's happening there, and your immunoglobulin E amounts will increase. With intolerance, though, any adverse reaction to food will be a sign and a symptom, but skin pricks and other tests, like blood tests, are not a good confirmation of it. My sister is a medical doctor. She's a pathologist at Bryant Hospital, and that's one of the things she'll tell people, that with blood work, sometimes you can figure things out with it, but most of the time you'll get a lot of false negatives. And the best way really when it comes to these reactions is to eliminate it from your diet for at least 7 to 14 days, and then add them back, the offending foods back in one at a time, and then see what happens. Because there really just isn't a really great test to be able to figure out exactly if it's one of these intolerance type of situations. Now, typically this little infographic, so food allergy is immune reaction, food intolerance is difficulty digesting, unless it's also stimulating that immunoglobulin G reaction, which is now an autoimmune condition. That is your immune system, but it's not the same thing as this. You're actually attacking your own tissue, and that typically goes with these. And then a sensitivity is the umbrella for both. So when you talk about food sensitivities in general, you're talking about a food allergy or an intolerance. It's just any of them within that umbrella. So this is interesting. So we know what endorphins are, right? They're our own natural opioids. They make us feel good. They also are painkillers for the body. They bind at certain receptor sites in the brain. What's interesting about morphine and heroin and opioids is that they are chemically similar to endorphins, and they will bind at those sites too. Unfortunately, with those types of drugs, they actually will stay there and suppress the body's natural ability to produce its own endorphins. which ultimately causes a lot of problems for people that are addicted to those types of drugs. But what's interesting, you might not have heard of what's called an exorphin. It was coined by, that name was coined by Dr. Christine Zudreau, I believe is her name, and her colleagues. They had a study with wheat plus digestive juices that would create what are called polypeptides. And these polypeptides could actually pass through the blood-brain barrier and act very similar to endorphins. So you ever eat bread and feel good? Lots of people do. And the thing is, they actually did a study and showed, so naltrexone is an opiate blocker. They used little guinea pigs and they gave them this like wheat protein, and then they studied some of their bodily functions that changed after they ate the wheat protein, right? That showed that there was some endorphin type of reaction. Then they gave them naltrexone and gave them the wheat solution, and those things did not occur. So we do know that there is some type of exorphin type of like an endorphin-like thing that happens when you eat wheat and possibly other things. I think they might have also did it with other things. I don't know if I mentioned. Oh, they did. Milk, corn, barley also did the same exact thing in lab tests. And I thought this was just funny. Exorphin junkie, confessions of an amateur bread baker. We're all addicted to bread. So what causes food allergies and sensitivities? Unfortunately, nobody knows. We've got lots of theories though. So these are the common ones. Gut dysbiosis means that all of your good bugs, all your buddies in your gut, that they're off, they're kind of off. You don't have the right ones or the right number of the right ones. Leaky gut, which I mentioned, that's where proteins are able to get through that intestinal lining that shouldn't, which can cause infection and inflammation. Lowered enzyme levels for digestion. Lowered hydrochloric acid in the stomach, because if you don't have enough hydrochloric acid in the stomach, that's what actually breaks down protein molecules. So if you don't have any hydrochloric acid being produced in your stomach, you're not going to break them down, so you'll have larger proteins that will actually be able to get through a leaky gut barrier, which is a problem, which is one of the reasons why, say somebody starts with a wheat problem, and then all of a sudden they get a corn problem, and then all of a sudden they can't have milk. So why all of a sudden? It's because they still have a leaky gut, and so anything that they eat a lot of that's hard to digest could get through that gut into the blood, and if it does, then it will incite the antibody reaction, and then and they know that when someone tends to have this problem, they'll tend to have more unless they correct it, right? Toxic chemical exposure. They have had actual cases where they had, I can't remember where it was, but it was like a chemical plant. It had a big, huge problem where a lot of the employees were exposed. And I think it was like 80% of them ended up getting some type of a food intolerance after that. So what they believe is the chemicals probably actually cause some damage to the intestinal lining. So that can happen. Bottle fed versus breastfed, we'll talk about that. And severe nutrient deficiencies. So, gut dysbiosis. So you have friendly gut microbes in between 500 to 1,000 different types of species. But actually, the Human Microbiome Project, anybody ever heard of it? It's this huge research project that they have all these really smart people doing. I don't know if you do remember the Human Genome Project, way back when. Well, the Human Microbiome Project is the current one that they're doing like that. And I believe the last time I checked that they had found over 3,000 plus or minus types of microbes on and in the skin that are absolutely essential for your health. So when you think about microbes as the enemy, they're not. Less than 1% are pathogenic. Almost all of them are beneficial. And so you have to consider that when you think about like antibiotics and antibacterial almost everything, because we are sterilizing our bodies. And my sister I was telling you about, she has made a comment on this. There is a part of their hospital wing that is for people that have, I can't remember the term of it, but basically it's where their gut has become kind of sterile. They don't have a good microflora in their gut. And she said she feels really bad because she never wants to go down there because the stink it's a certain kind of smell. Their bodies are they just don't operate. So you absolutely do need your good buddies in there. They keep you healthy. And the thing is they do more than just hang out. They make vitamins, a lot of B vitamins, certain microbes, that's part of their metabolic process, so they give you vitamins. They make enzymes for certain things for digestion, including milk. Communicate with your immune system. That's the most interesting thing that I found about that microbiome project. They don't know how or why, but there is some type of communication that goes on between those friendly bugs and your immune system. They actually do help prevent harmful microbes from taking up residence. And your body knows which ones are friendly and which ones are not, because it won't attack the ones that are natural to your system, but it will attack the ones that are pathogenic, that are unnatural to it. They call them like familiar friends, the ones that are good. So we kind of talked about antibiotics. So let's expand on that. So antibiotics, I'm not like an anti-drug person. I think there's a time and place, but they are good and you need them. But I think it's good to be educated. So an antibiotic, when you take a broad spectrum antibiotic, it is going to kill a pathogen, right? But it is also going to kill all of the good bacteria in your gut at the same time. And the current studies are indicating that it takes almost a year to rebuild the friendly bacteria in your gut after an antibiotic treatment. How many people have had like at least 5 antibiotic treatments in their lifetime? I mean, seriously, probably more than that. And so it really, so if you're gonna die, pump me up, you know what I'm saying? Put it right in, IV. I don't wanna die. I'll deal with my gut later. You know what I'm saying? But if it's for the sniffles, consider whether or not it's something you wanna do, because it is going to destroy your gut flora at the same time. So you weigh it, you decide what's best for you. Candida Albicans. So this is, you've probably heard of it. Some people have, some people haven't. It's a naturally occurring yeast in the colon, and you do need it, so it's not bad. But the problem is that this is another issue with antibiotics. So if you kill all the bacteria, right, then it does not kill the yeast or fungi. They're really hardy. They do not kill that. And so now all of those bacteria that were actually kind of adversarial, didn't let the yeast or fungi get too much, square footage. Now they're gone, and the yeast, which are very, very hardy, start rapidly multiplying. And then this is where we get too much of it in the gut, and it can actually mutate and become kind of a little pathogenic in that it starts to burrow into the intestinal wall, which can actually eventually get into the bloodstream. And then we have a real problem, because what happens now is we have yeast or fungi that can get into the blood and go systemic. And anywhere it's warm and moist, it's going to set up shop. Like armpits, obviously feet, we know that, right? Athlete's foot. So anywhere on the body. And so we might treat the symptom, but most of the time there is a gut problem. That it started there, and that's where it got into the blood, and then it traveled to a different spot. And now you have, so if you're going to, say you have some in the armpit, and you can get it in your mouth, I mean like thrush's mouth, you can treat that symptom, but if you don't fix the gut problem, it's going to keep coming back. Has anybody ever had a toenail fungus? Oh my gosh, they're the worst things to get rid of. Until that gut problem gets healed up, most of the time they just keep coming back. So that's gut dysbiosis. Leaky gut. It's kind of a cool little thing to kind of give you a visual. This is where it would be normal type junction. So there should be a junction there, because you do actually want nutrients to get into the blood. That's how you feed yourself, right? It goes into the intestines, and it's all broken down, and then the nutrients go into the blood. So that's supposed to happen that way, but when there's issues where those have become a little less tight, that's where the leakiness comes in. Bigger molecules, bigger proteins can get into the blood, and that's where those antibody reactions can occur. And so, interestingly enough, Dr. Isabella Wentz, she's a doctor of pharmacology, has said, gluten has been the most well-researched protein-associated immune reaction, and it seems to cause an increase in intestinal permeability in everyone, not just those who have a genetic susceptibility to gluten sensitivity. We've actually had some studies that have shown that that gluten molecule can actually cause this disjuncture for like I don't know, a couple minutes. So it's not like a long, long time, but it is open. And so if there happens to be a protein that gets in that period of time, well, once it gets into the blood, your body's going to start to consider that to be foreign, and then it's going to build an antibody reaction. Okay? Do you have questions about this? Because I'll just speed along. You guys just go ahead and stop me if I go too fast. Lowered enzymes and hydrochloric acids. They're basically impaired digestion. So it's starting right here in the stomach and in the liver. So your body makes digestion enzymes, reduces food down to its smaller molecules for you to be able to absorb it. It's made in the body by parotid glands, which are here in your cheeks. That's actually where you start digestion. Your gut, and pancreas, and liver. So you've got a couple different places that those are made. You also make detoxification enzymes in several of those. They're made by the body in the parotid glands, again, here, the gut and the liver. Now, if production capacity is limited, then your body's going to have a hard time detoxifying, which is going to lead to damaged tissue. And so HCl in stomach acid activates pepsin, which is an enzyme that breaks down proteins, and we kind of talked about that a little bit ago. And if those proteins don't get broke down, then you do have the chance, remember, with that leaky juncture, for that to pass through. Proton pump inhibitors, anybody on a PPI? For acid reflux, those shut hydrochloric acid production down completely. That's what they do. They're designed to do it that way. So you will always have problems with digestion on a PPI. And there's natural things that you can do to correct that many times. Lots of things on the walls about that one. That one's not too hard. Toxic chemical exposure. Case studies have confirmed that this actually can cause food intolerance, like I had told you about with that one group of workers that had been exposed to toxins. And people that have enzyme deficiency, so this right here, they will actually be more vulnerable to toxic chemicals and heavy metals because like your parotid gland makes those enzymes that help to tag those chemicals and heavy metals for elimination. And if somebody, if it's kind of overwhelmed, can't meet production needs, like you've got too many stressors going on, then your body's not going to be able to detoxify properly. So that's where that becomes a little bit of a problem. So this is where bottle feeding versus breastfeeding. They have had some studies that have shown that exclusively breastfed babies for at least 6 months are less likely to develop food allergies. That being said, if somebody has a food allergy and they have a child, they are very likely to have the same allergy. So if you have one, your progeny probably will develop it, especially if it's autoimmune, because those are antibody related, and most likely those will affect the baby while they're in utero. Babies' gut linings are actually hyperpermeable, so they're leaky intentionally, because you want, when you're breastfeeding, the baby needs to be able to get those proteins into its blood very swiftly and efficiently. They eat like every 2 hours, you know what I'm saying? But they need to do that. This is where there's a problem when we start to give like rice cereal and other grains that are thicken up like formula. It makes them so they don't want to eat very often, but you have to keep in mind that their guts actually are leaky by design. And so and it's very possible that those proteins are not being broken down because the baby does not have the necessary enzymes to break down grains until they're 1, that they will get through the lining into the blood and can start this process very early. So keep that in mind. Breast milk proteins are easier to break down due to enzyme content. So a mother, when they makes the breast milk, actually has natural enzymes in it that helps the baby to digest, and formula doesn't. Now, if you can't breastfeed, of course, you get formula. You know, there's no judgment there. But just so that you know, that's where what the study is for. This is very interesting. A lot of people don't know about this. I actually learned this in my MD program. It's called the Laporte technique. This is just a couple of them. But what he found was that when someone has a food intolerance, there's typically nutrients that are severely deficient. that have led up to them having these problems. For instance, with milk, there usually is a severe vitamin D deficiency and potassium, and then they're usually deficient in asparagic acid and asparagine. So a vitamin, a mineral, and amino acid. And I have found this to be true clinically. People that have a milk problem, they do tend to have a deficiency in that. And when those things are repleted, they do tend to be able to eat it better. Now that being said, that's with mild intolerance. If someone has an allergy or if they have an autoimmune condition where an antibiotic body reaction is occurring, they probably are not going to be able to eat that food. But it still gives us an idea that this person is deficient in these things and we can replete them. Kind of an interesting thing. He actually had a big long list of different things that you need to take for different food sensitivities. So this brings to how I can help with this, what I do in the office with the majority of these types of people. Food disorders. When you have a food disorder, even if it's mild, it's going to lead to more often in severe symptoms, right? More stress on the organs. You're going to use up more vitamins and minerals because your body's stressed, which is going to lead to a slight nutritional deficiency, right? You might not even notice it, right? But the problem is now you have less vitamins and minerals that you actually do need to fill your organs. So now we're going to have a little bit less organ function. And now we're going to have a little organ dysfunction. Now our organs are not working 100%. Maybe it's 99 in the very beginning, but it's decreased. And you have a decreased ability to absorb, digest, and utilize vitamins and minerals, which is going to lead to more food disorders. Which is going to, more often and severe, more nutritional deficiency, and maybe we get down to like 95%. But you can see how over years and years, and this is how it happens. It's a snowball effect. This isn't like happening overnight. Over years and years, now we're down to like 25%. It's just every day, a little bit less, a little bit less, a little bit less, a little bit less. And so how we can help with this, first we have to figure out what specific vitamin and mineral deficiency that you have. Because you guys are all very unique, and there's no one-size-fits-all program for anybody, really, truly. But we have to figure out that first, and then we have to figure out exactly what organs are being affected by these the imbalance. And then we have to fix and handle them once and for all. So we're going to have a little bit of an exercise. Get into your little goodie bag, anybody that hasn't done this yet. What color is it?
Some are orange, some are purple.
We have some orange and purple sugar quizzes. And so I'm going to give you a few minutes to take that test.
Okay.
Would you like a little board to use?
Just get one to Dad.
Oh, you sure?
I'm good.
Okay.
Yeah, you both get one.
Yeah, you both have one.
We don't play with excuses around here.
Kelly don't play.